Hello, and thank you for tuning in to another video of mine. This is a series of talks that I'm doing concerning abdominal discomfort. They're entitled Abdominal Pain Evaluation in the Emergency Room, and this is going to be actually part 4. And if you've not seen the other videos, there'll be links at the end of this video, so stay tuned. Watch this video to the end, and then click on those links and go back and watch the other 3 videos, as you'll gain a lot of information from them as well on other areas of the abdomen. But first, my name is Andre Huey, and I am a physician assistant working in the emergency room taking care of patients. And abdominal pain is a very common complaint that I do see in the emergency room and that I take care of. So I gather all of that information to talk to you about on this video from several years of experience and thousands of patients that I have taken care of. And as I mentioned earlier, I'm going to focus on this video on the right upper quadrant and what are some of the conditions that can be going on to cause pain or discomfort in that area, the right upper quadrant. So I'm going to tell you very briefly the different quadrants, and then I'm going to jump into the conditions that can cause discomfort in the right upper quadrant on this video. Very briefly and quickly, when we examine a patient, whether it's in the emergency room or your doctor in the office or urgent care, and you're having abdominal discomfort, one thing that helps us to zero in on your pain and what potential causes can be is that we divide the abdomen into 4 quadrants. You draw a line from left to right across the abdomen where the line goes through the belly button or the umbilicus. That divides the abdomen into an upper and a lower abdomen, and then we go down the center from just under the sternum all the way down through the umbilicus, and that makes a line dividing the abdomen into a right and left side, and it ultimately makes a perpendicular line where it intersects at the umbilicus or the belly button. And so it divides it into 4 quadrants, okay? The right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. Today, I'm going to be talking about pain, discomfort in the right upper quadrant. So let's jump to that and talk about those conditions for you. One of the most common conditions that people think about when they hurt in that right upper side is it my gallbladder? And it could be gallstones causing the pain, or a low functioning gallbladder, and that's pain without infection or inflammation. But it can be also cholecystitis, which is a fancy way of saying that your gallbladder is inflamed or infected, and that causes pretty significant pain. It's diagnosed through history from you, physical examination, blood work, and also an ultrasound, and also sometimes a CT scan, which will show inflammation of your gallbladder. Sometimes it might not show inflammation if there's not any or no infection. It could just show stones, but the fact that you're having pain there could indicate that it is your gallbladder, whether it shows stones or inflammation or infection or not. And that's up to your provider to determine. And I'm not sure if I mentioned this earlier or not, but I'm not going to go into a lot of specifics about the treatment plan for some of these conditions. I might mention a couple of things, but ultimately on this channel and on these videos, I try to let that be something that your medical provider ultimately decides for you, because they're there with you and they know the situation that you're in right at that moment. Therefore, they can come up with the best treatment plan for you. So the first one could be your gallbladder, could be inflammation or stones, low functioning, or all the above. The next condition that can happen is that it could be inflammation of the tissues in that area, intra-abdominal tissues. It could be the lymph nodes, it could be the tissues around the intestines or the lining of the abdomen itself causing pain. Another condition is that it could be inflammation of your liver. And then that could be caused by a virus. It can be caused by certain medications. It can also be caused by alcohol consumption. And sometimes that can be seen on a CT scan or ultrasound, and other times it might be only evident on your lab work. The chemistries that they draw or complete metabolic profile will show your liver enzymes, and sometimes you're having pain in the right upper quadrant, and on your blood work, your liver enzymes will be pretty significantly elevated as well. And that helps the medical provider to determine that that is what is causing your symptoms. Next could be a spasm in your intestines in that area in the right upper quadrant. The large intestine makes a turn in that area, and that can be a common area that you would have a bowel spasm there, especially if you're having something, or if you have something called irritable bowel syndrome or IBS, where it's a functional problem where your bowels tend to be more spastic and more sensitive to that, which can cause pain. And on the heels of talking about spasms and irritable bowel syndrome, the next thing could be that you could be constipated. You need to poop more. And if your medical provider determines that that's what is wrong, then they're going to give you the best treatment plan that they can come up with depending on how severely constipated you are and how bad your pain is. A person could have a urinary tract infection causing pain in the right upper quadrant. Sometimes it will wrap around to the back. Urinary tract infections, especially in women, if they are very rapid, progressing, or if they're not treated in time, that infection can go up to the kidneys and cause swelling of the kidneys and sometimes an abscess in the kidneys. And this is a condition called pyelonephritis, or an inflammation in the kidneys from a urinary tract infection that's gotten really bad, and that causes pretty bad right upper quadrant pain and also left upper quadrant pain, but we're talking about the right upper quadrant on this video. And it's typically going to cause pretty severe pain in the right back and right side as well, and in a lot of cases a pretty high fever. And that treatment plan would be up to your primary care or your provider that's taking care of you in the emergency room to decide, do you need to go home or do you need to be admitted to the hospital? Another reason that you could be hurting in the right upper quadrant is a kidney stone. And as I've mentioned in other videos, kidney stones are pretty prevalent in the United States, and in other areas of the United States it's even more prevalent, especially where I am in North Carolina. It's pretty high. We're considered the kidney stone belt in the area where I work. So we see thousands of patients every year with kidney stones, and that's where you have a stone that has developed in your kidney, drops out into the tube between the kidney and the bladder, and as it's moving down it causes significant pain. And sometimes that pain will also be in your side and your right back as well, and it can also happen on the left side. But anyhow, that's determined by looking at your blood work, hearing the description of your pain, physical exam, and then you can see the stone on the CT scan, and you will get a referral to a urologist. And typically folks with kidney stones do go home with a treatment plan to see a urologist as an outpatient, but on other occasions, sometimes they need to be admitted, and it's up to your doctor seeing you at the time to make that decision for you. You could also have an infection in your colon called diverticulitis. We talked about this on other videos. It's more common in the left lower quadrant, but anywhere your large intestine tracks, which the right upper quadrant is one of those areas, you can have diverticulitis there, and it can cause pain also, so it's something to be aware of. You can also have colitis in that area. That's either an infection or an inflammation in your large intestine or your colon. And again, it will be up to your medical provider to decide, is it an infection? Is it an inflammation? If it can be determined, and they look again at your blood work, your CT scan results, and your examination, and also your history. Do you have a history of inflammatory bowel disease or Crohn's disease? That could be one of the things causing that colitis. Sometimes you can have a rash, a painful rash that's called a shingles rash or a zoster rash, and that comes up from the herpes virus, ultimately from chickenpox that you've had way early on. That is a herpes virus that causes chickenpox. When chickenpox rash goes away, the herpes virus goes asleep in our skin, and it wakes up down the road for whatever reason, and it presents itself as a one-sided rash, and it can happen anywhere on the body, but it's usually one-sided. So the right upper quadrant, if you have a rash there and you have pain, that could definitely be the cause of the pain. It could be a shingles rash or a zoster rash. And again, your doctor will come up with a treatment plan for that. Another cause of pain in that area could be a pulled muscle, a musculoskeletal pain, or it could be a pinched nerve, or it could be a back pain, maybe a bulging disc or a disc problem in your back that's radiating around to your right upper quadrant from your back. You could also have an ulcer in the first part of your small intestine called the duodenum that comes off of your stomach. Sometimes if you have an ulcer there, that tends to be more on the right side, and that can cause pain there as well. Some things that you may not consider that would be causing pain in your right upper quadrant. One of them is pneumonia in your right lower lung. An infection or pneumonia in your right lower lung in the right conditions can actually cause you to hurt in your abdomen, and especially your right upper quadrant. And again, that could be seen on CT scans or chest x-rays and a lot of other factors that go in with your examination and your history as well. If you have a blood clot in your lung, that's called a pulmonary embolism. And if it happens to be in the lower part of your right lung, that could cause pain to radiate down and be in your right upper quadrant also. And again, those things are typically seen on special CT scans called a CT pulmonary angiogram, and they can be seen in the lungs in the right lower quadrant. So that's something that can be causing pain there as well. And another thing that could be causing pain in your right upper quadrant, something you may not think about, could be your heart. You could be having a heart attack or inflammation around your heart. So those are some of the things that your medical provider is going to be looking for. Some things you see on blood work, you come up with that during the examination. Sometimes it requires imaging. If your medical provider thinks that it could be your heart, they're going to order heart enzymes, and they're going to order an electrocardiogram to look at your heart tracings to see if that shows any evidence of heart damage. So overall, these are conditions that can be causing you to have discomfort or pain in your right upper quadrant. It's probably not an all-inclusive list, but those are probably the most common. So I hope this made sense to you. I hope it helps you. Please leave a comment. Let me know if you found this interesting, if you found this helpful. If you will, please subscribe to this channel, like and share this video with your family and your friends as they can benefit from all this information as well. And check out links to the other videos. Go check them out and watch them, as they will also help you. Take care.